So our topic is longevity, but before we get started, I just want to acknowledge our traditional healers of the land on which we're meeting, and that's the Whadjuk people of the Noongar Nation. And also recognise your own ancestors, and thank you all for being here and your ancestors for bringing you here. When we talk about longevity medicine, we're talking exactly as we said in the room. We know that we can live longer lives. There's ways to maintain the length of life, and statistically this has changed over the years. So I was born in the 70s. Some of you look younger than that. Some of you maybe even joining me in that space. So when I was born in the early 70s, typically a woman could expect to live until she was 75. 75-ish, 75.4 was the stats. And a man could typically live to 67.8. Now we've stretched that. We're living longer. So now a woman can expect in Australia to live to 85-ish, 85.4 is the average. And for men, they've extended their lifespan to 81.1. So we're living longer. So we're nailing that already. We're living longer. But unfortunately, our last 12 years, statistically, are spent in chronic disease. And for some people, that means they're in nursing homes, they're feeling like they're a burden, they're not living well. They're following the genetics, they're following the pathway of what's been given to them. They're not improving their health span. So longevity, when we talk about, it's not about living forever. Some people might want to live to their 120, and that's great, good on you. But it's about making sure that your lifespan is equal to your health span, so you're living well. You get to the point where you fall off the perch running along the beach or chasing after your teenage children. You're living well into those later years. And that's really what we're here for. So Dr. Mark Hyman really defines it in that way. Dr. Mark has lots of amazing books if you're interested in reading. He's got a book called The Pegan Diet, which I think is fantastic. He also has a podcast called The Doctor's Pharmacy, spelt with an F, not a PH. He's kind of one of the fathers of functional medicine, if you like. So I've created this little pyramid for us to work with tonight. I call it the architecture of longevity. And you'll probably hear us talk about different aspects of this. But what we really start with in the foundations are the foundations of health. Diet and nutrition. We can measure some of those things through blood tests, gut health, hydration, having a good social circle. I was reading last night because my beautiful husband went out for the evening, so I had a bath and read a book. He's sitting behind you, Peter, if you want to say hello. So Nathan was out and I decided to have a little bit of a read of the book while I was in the bath. And Ikigai, has anyone read this book or come across it? So this is a lovely book. It's the Japanese guide to living long and living well. And we know that Japanese populations have some of the longest lived people in the world. They're quite known for that. So they have the most octogenarians, people living over 80, and the most centenarians, so people living over 100. There's something called the blue zones, if anyone's ever read about the blue zones. And this was a piece of research done by Dan Buehler and his team, where they looked at the most long-lived populations around the world. And Ikigai really does talk about the Japanese component of that. And one of the things that they talked about, specifically in the Ikigai book, is they interviewed all of these people living over 100 and looked for the commonalities. And I just thought I'd share with you some of those commonalities, and they're there in the foundations. So some of those common things for people living over 100 were social connections, the importance of community, the importance of having people you can trust, people you know that love you, people you know that you can talk to about what's going on, and having a sense of purpose. And for some people that's volunteer work, still working. Many of these people into their later years are still doing something that they're contributing. Or for some people, their sense of purpose was bringing up the next generation. For some of them, it was their garden. And in fact, the one thing that every person over 100 had in common when they interviewed them, they all had a garden. Yeah, and they were, some of them growing their own vegetables, but all of them spending time in their garden. So spending time in nature is there in the foundations as well. So that's sort of setting the scene for us. And we might talk more about some of the weird and wonderful things. We might talk about peptides and saunas and red light therapy and any questions you have. There's nothing that's off the table. But I thought we could start with some questions to our panel. How does that sound? Great. So,
Not scary at all.
not scary at all. So I wanted to really open up the discussion first of all on how do we measure longevity? So what are some of the things, we all know that we get to a certain age. How do we measure what's happening on a biological level to help people understand their longevity? Can we start with you, Richard? What do you think?
Yeah, so I think with longevity, I mean, it's about doing a lot of the basic stuff really well, isn't it? You know, some of the advances that we've had in the Western medical sphere, certainly since I was a junior doctor, you know, when I was a junior doctor back in the 1990s, you know, we would frequently have guys coming in with heart attacks, myocardial infarcts, you know, in their late 30s and 40s, you know, early 50s. It was very commonplace, but now, you know, that's a rarity, really. And, you know, that's been about pretty simple things like smoking cessation, blood pressure control, and obviously things like cholesterol management. You know, so it's about us doing some of the simple things, you know, sensibly and regularly. We don't want to be over-testing, you know, but we need to be doing the right test at the right time.
Yeah.
But in addition to that, these days, you know, certainly here at Remede, we've got access to a lot more testing modalities, you know, that go a little bit beyond that. So we can do things like smart DNA analysis, so we can look more closely at people's genetic risk profiles and manage that accordingly. And a further refinement to that is an epigenetic test. So that's not so much about, you know, what is your genome, but what are those genes that are particularly active at the moment, and what genes are particularly, you know, maybe you're switched off, and that can give us a lot of information about biological age compared to chronological age, and all of these testing refinements allow us to hone our preventative health strategy much more to that individual person rather than just being purely on a population basis.
The technology certainly really boomed, hasn't it, in the last 20 to 30 years? We can look a lot deeper.
Yeah, it has, and you know, with testing, as I say, you don't want to be over-testing for the wrong reasons. So from our perspective, you know, we always really want to know, you know, what information a test is going to give us before we order it. It's one thing doing the test, it's the interpretation, you know, and the explanation, and that's you know, really where the key interventions are made. Yeah.
See, well, what do we do with that knowledge, and how's that going to impact our treatment?
Yeah, that's right, because we don't want to be scaring people. You know, we want to have good concrete information that we can actually do something about, you know, that's manageable, that fits into people's lifestyles well, but is going to make a good and meaningful improvement.
Great.
Yeah, I think you're right. You know, there's so much out there, and you can pretty much order any test you want, you know, without having to see a doctor or a practitioner at all. You can order any test you like, you know, pretty much over the internet, really, you know, and there's a lot of providers out there doing, you know, for example, whole body MRI, which is a really topical one now, you know, but that can really cause a lot more harm than good, of course, you know, because it can leave people with questions that are half answered, you know. This may represent an increased risk of X, Y, or Z, you know. Dementia is a good example, but, you know, what are you going to do with that information? I mean, you can use it sensibly, you know, you can do the tests properly, and you can, you know, have practitioners around you that really do know how to use those tests. And I do think, you know, whilst I don't want to be overselling the clinic, you know, that's a real highlight of a clinic like ours. You know, obviously I'm a Western trained doctor, I'm very experienced in Western medicine, you know, but from my perspective, being able to pool my knowledge with, you know, my colleagues here, you know, just really just increases the range of what we can offer, you know, increases our toolkit that we have available for managing, you know, quite complicated and tricky scenarios like you described there.
And that's why at the bottom of my pyramid there, I don't know if you can quite see it, but guidance and expertise for me is it's an underpinning factor, because we do have, in my over 25 years of being qualified, what I did as a naturopath 25 years ago is very different to what I do now. Is very different to how I help people to understand the information they're receiving from AI some of the times, a lot of the times, and from maybe tests that they've done elsewhere, and really bringing that together with expertise. And also, as Richard said, being able to collaborate with others who have other areas of expertise is absolutely phenomenal. Thank you. Can we ask Jane as well the same question?
What was the question?
Yeah, that is a very good question.
Yeah.
Measuring longevity.
Oh, measuring longevity. Well, it's all, food is medicine. So that's, what I want to say first of all. How I would measure longevity is living a well, healthy life, but being able to be independent. So living independently and being physically mobile. So I think, to me, that indicates longevity, being able to get yourself out of a chair, get yourself off a toilet, and not have to go into an aged care home at 65 and 70 with dementia or a broken hip because you've got osteopenia, osteoporosis, you don't have enough muscle to keep you upright because you haven't exercised or fueled yourself appropriately for you. So, and we hear so much information on the interwebs about what we should be doing, and it is totally overwhelming. And, I have clients that come and say, I'm taking this, and shall I take this, and shall I take this, and what about methylene blue, and what about this? And I go, hey, what about we eat some fruit and vegetables and see how much better you feel? What about we focus on your sleep? What about we get moving? So for me, one of the simple tests, and I do see it on the interwebs, is, can you get yourself off the ground without using your hands? Okay, that's a measure of longevity for me. Can you
we
get
don't
off
have
the
space
toilet?
for everyone to try it.
Well, I was thinking, should I try it? But then I thought, no, I did leg day this morning, so I'm probably not going to give that a crack because I won't even be able to get up the stairs tonight. But it's all good. So yeah, that's my answer. Yeah, strength. Can we get up? Can we be mobile? Can we hang off a bar? Those sorts of things. We might be in a position where we haven't exercised, we haven't built muscle. And I think about my mother, who was a registered nurse until she was 70, and she had injuries all the time from really, they didn't have orderlies. They lifted the heavy men on night duty and rolled them in beds, and she hurt her back and her neck. And she's always to me like, don't lift anything too heavy. And I'm like, Mum, that is all I do is lift heavy things because I don't want to be like you.
Yeah.
And not in a mean way, but that was just the generation. They didn't lift heavy. They didn't understand the need for muscle. They didn't understand that. And I don't know. Did I answer the question?
You did.
Yeah. And it's not too late to start building strong bone or to try to hold on to your bone, but it comes from the nutrition and your activity. So strong muscles will keep you upright because falls risk, Mum gave me the stat the other day, did you know that blah, 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 people fall every day in Australia and they break their hips and they don't come out of hospital? I was like, yes. So, muscles will protect your bones, and they will, by increasing your muscle mass, will pull on your bones, and that also increases your bone density.
So can I ask broadly to the group then about muscle? Because one of the things we're seeing a lot, one of the medicines that's on the rise at the moment is the GLP-1 injections. You've probably all heard of those injections.
The weight loss injections.
The weight loss injections, Ozempic, Mounjaro, these sorts of things. So the classification is the GLP-1 classification, and one of the risks that we're seeing with that is the decline in muscle, because the mode of action of those medications is to slow gastric emptying, reduce people's appetite, essentially reduce the food noise. We can discuss the pros and cons at some point, but what we're hearing there is that lack of muscle or the decline in muscle. I don't know if Adam, maybe if you want to jump in on that. What do you think about quality of muscle?
Well, this one's actually not really my field. This is probably a little bit more clinically appropriate for you guys. But I did want to pipe in and say that while lifting heavy weights is important, we flash back to the Ikagai or the blue zones as well. None of those peoples were lifting weights. None of those people in those communities were, there was no gyms there at all. But what they did have was active movement. And it's more about, I like to think about living well. The priorities for me are in this. I think we can all agree that these foundational elements here. No matter what kind of modality you do, they are 100% the foundation. But it's about movement and mobility. I think is the priority. I always suggest to my patients to do more isometric type training, whether it be Pilates. I'm a big fan of Pilates because as you get older, it's one thing, it strengthens your core. It's very core focused, but it's one thing to be strong. You don't necessarily have to be at the gym, but you do have to invest. You have to make that investment. You have to be consistent with your time. You're either going to invest your time and get your feedback in return that way. Otherwise, you're going to be investing your money in what it costs to get returned back to wellness. Everyone has their own signature, and some things work infallibly well for others. So we're not here to point fingers, but it's a matter of about finding the signature that works best for you and then to support that as well, whether it be a clinical answer and then supporting it with nutrition and an ancillary advice from there.
Maybe Richard, you might have some experience with patients on GLP-1.
We obviously had a lot of experience with the first drug that came out, Ozempic, and then another drug, Wegovy, which was basically the same as Ozempic, but just via a different manufacturer. A newer one now called Mounjaro, which I think a lot of us find is the most effective of those weight loss injections, and they certainly have been incredible game changers for the right people. Whilst the talk tonight's not about obesity, we recognise that obesity is a disease and it needs to be treated in the same way as any other disease, and the injections, which obviously tend to switch off appetite and make people feel fuller with much less food, have been incredibly successful in helping lots of people lose weight. But as you allude to, Julia, a lot of people just rely on the injection alone to do the whole thing, and they basically put themselves into a starvation mode, and they get on the scales and think, phenomenal, I've lost 5 kilos, 8 kilos, 10 kilos, but a lot of what they've lost is obviously muscle mass, because unless you are eating an appropriate, decent high protein diet, and you are doing some strength and resistance training, your body is going to break down the muscle to provide itself with calories. So, the way that we like to go about it, preferably, is to do things like regular DEXA body composition scans, so we can see what's being lost. Is it fat or is it muscle? So the injections can be great if used in the right way. Yeah.
Thank you. My next sort of topic that I wanted to cover was a little bit more around the nervous system. So in those foundations there, we've got sleep and sense of purpose, rest, and also that social community, that sort of how we support ourselves with people around us and how we're supporting our mentality as well as our physicality. And anyone can pick this up, but how does the work that you do as a practitioner fit into that neuro-wellness model?
Lots of people want to talk about the vagus nerve, and it is hugely influencing it goes through all of our organs. It starts in our brain and it ends in our large intestine. But as an acupuncturist, do I treat the vagus nerve directly? Not really. I guess I treat it indirectly. There are points in auricular acupuncture which is responding to the vagus nerve, but that's purely by its location. But acupuncture, much like the vagus nerve, is working with the parasympathetic nervous system. And so you can influence all the different organs in the body with acupuncture. But talking about the biohacking as well, and I guess staying on theme here, what I do like about the acupuncture is it has that calming effect. And I have patients come in and they're a little bit apprehensive if they've never had acupuncture before. And fair enough, you're about to get potentially a piece of metal in your skin. And I even have my own reservations about needles at times as well. But I find that 90% of the time people tend to either fall asleep or find it really comforting. They feel very relaxed. That's one of those things. It's got to do with also, I guess, the release of like the endorphins as well in the body that help you relax. But it's working with that parasympathetic nervous system, promoting the calm. And calm is one of those elements that is in in the blue zones. It's all about this community and wellness, but it's mindfulness and not being too stressed. I think it's hard to ascertain that type of wellness in our current climate, in our current daily lives, because we're all pretty stressed, but how are we actually offsetting it? And there's lots of other things we can do, like diet, sleep and exercise, but it's really that mindful element that we really need to focus on. And for that reason, I really recommend or put acupuncture forward, because really you just have to lie there and just let your body do its thing, and we can really tap into that neuroendocrine element and help you relax.
Yeah, good stuff. Because when you talk about parasympathetic, just for anyone who's not quite across that, so our nervous system has two channels to it. The parasympathetic is the calming side, as Adam rightly said. The sympathetic nervous system is really our kind of fight, flight. That's what takes us into action. And really, as a human race, that's where we're living. As a cave dweller, we were mostly calm and relaxed, and we would have short periods where we would have to go out and find wildebeest or whatever it was, probably not wildebeest, but big things to kill. So we were short bursts of stress, but most of the time we lived in calm. And now our world is very much the other way. We have to intentionally find calm, and practices like acupuncture can be amazing for stimulating the parasympathetic nervous system. I would also maybe even put in there things like osteopathic medicine. I love visiting our osteopath for that. Chiropractic, for a lot of people, they find very good because it's realigning the nervous system. It really is helping your body to feel safety, and that's what we're really talking about, isn't it? It's creating that sense of your body being in a safe place.
Sorry, and also the other practice of like Tai Chi or Qigong or yoga, all those things are a great way to reconnect with the body and have that moment of stillness and hear your breath and feel and be in the moment and just escape from those exterior stresses and pressures, even just for a moment. It's so important to do that.
Even a bubble bath while your husband's out
or
for the
a
night.
bubble bath.
Yeah. Counselling as well. I think, if I think about those green areas there, the personalised medicine stuff, if stress or if we are in that fight or flight long term, that can lead to what we call in our world adrenal insufficiency. And that can, counselling can be an amazing part of recovering from chronic stress, because it's giving your mind a place to go. You know that you've got a safe, confidential space to talk about whatever it is that's turning your mind into turmoil, I think, in my mind. Anything else on nervous system support?
Well, I just want to add, on my treatment plans, I don't just talk about food. I'm like, you become the 5 people you're around or whatever, but I say, what is your daily joy? What is something nice that you're going to do? And I also created a little wellness journal, and in there is one section of, like, what are my goals for today and what am I going to do? But then it's like, what is my gratitude? And even if you have to force it, it's a practice like yoga, like meditation. You don't, in meditation, just have a blank mind. You have to practice that calming. And the practice of gratitude, while you consciously sit there and go, what is good that happened today? And it could be like, clean sheets are on the bed, or had a good coffee. Sometimes we're scraping the bottom of the barrel, but the practice of gratitude means that when you're being grateful and gratitude, you can't have any other emotion. So I go, when we're practicing it, it gives our body a little break, a little rest. So I go, what was your joy today? What was something delightful you did? Was it you text a friend, or, you picked some herbs from the garden, or you sat with your dog? What is it? And I think that's an important part of healing, not just what we're putting in or counting calories or what we're lifting. Challenge. It's, taking a moment to find joy and gratitude.
Yeah, love it. Okay, so if we can move to the next topic, if that's okay. So I've got these topics from people I've been talking to in the last couple of weeks, so patients here and also outside. The next topic I wanted to bring up, and this might be on other people's minds, so we hear a lot at the moment, particularly on social media and things, about autophagy and about this idea of the clean-up process that our body has to do. Now, we used to, again, when I was a little naturopathic student, we used to talk about detox, and now we're hearing things about parasite cleanses and all sorts of ways to encourage our body into this process of autophagy. So autophagy essentially means that as our cells are aging, There are processes, natural processes that our body goes through to basically take away the damaged ones. And for DNA as well, where DNA gets damaged, take away the damaged stuff, deal with it and remove it from the body. Who wants to talk to that a little bit? Just help us to understand, what practices do you recommend for that sort of detoxifying? Are you on board with parasite cleanses? We could be here all night.
A difference of opinion as well.
Great.
Should be good.
Fine.
Yeah, well, we do some great gut testing here to see if there are actually parasites. We use herbs and supplements and practices to help cleanse the body. I do believe the body, has its own if it's given the right environment, is detoxing and looking after itself. But then I will say that there are thousands and thousands of pollutants and endocrine disruptors in the world now that our body does not know how to deal with. So, I'm always guiding my clients into what is a low tox version of what you're consuming. Can you switch over to storing things in glass? Can you not heat things up in plastic? Refill a water bottle rather than buying it in glass. Maybe move away from synthetic fragrances or candles in the homes. To me, that's a really big part of detoxing. The other
so you're
thing,
looking more at what's coming in firstly before you even encourage
get rid of that.
Yeah.
And then within the body, yes, we can do cleansers or whatever, but I go, you know what? Let's encourage more fruit and vegetables. Let's encourage some filtered water, and let's not just be eating all the time. I know a lot of people are into fasting. I'm not so great for fasting because I just love food. I want any opportunity to eat. And it works okay to a certain age, particularly for men. They can really do well with fasting. But women, particularly perimenopause, menopause, postmenopause, fasting is not so good. What I like to focus on is time-restricted eating. So you know what? Have your dinner early when it's still light outside, like a pensioner, and stop eating the snacks on the couch and just wait until breakfast. That gives your body a rest. It gives your gut time to rebuild its microbiome. So that's my take on it. And who would you like to have a chat about it?
Yeah,
I can feel a fight coming on. It's great, the tension.
I think it's a good example of the difference between sort of Western medicine, and how we view health, as compared to natural medicine, and that's what I've found really fascinating, working here. Western medicine is basically about, trying to prevent illness, but essentially then diagnosing an illness and then treating an illness, and a very illness-focused kind of model, whereas natural medicine, the naturopaths are much more focused on regulation versus dysregulation, so a lot more sort of subtle changes going on, so what you describe is probably a lot more within your domain, I think, Julia, than would be mine. Yeah.
And I do things like the testing to start with. So heavy metal testing is quite common. There's a wonderful test now that Naturopath have started doing that looks at mycotoxins, which are the mould toxins that we're actually starting to see quite a lot of mould illness in Perth. I think we're starting to get a bit more humid in our springs and autumns. So mycotoxins, environmental toxins, so it looks for things like plastics in your system, but it also looks for the heavy metals and glyphosate, those pesticides that can reside in fat stores. And for some people, that can be, I've had people who have been mould affected from a house they lived in London 20 years ago, and they're still experiencing those symptoms now. So it can be a bit of a long-term stored thing. But Adam, you want to jump in on this? I can see you're itching.
I just think if our body goes into autophagy, and there's a lot of fantastic benefits. I read a recent report from Science Direct, and it was about the importance of of fasting and extended fasting to help with cognitive decline. And it's all about cleaning out our cells. And you think that originally we're not meant to eat 3 meals a day. That is not how we are designed. And this actually does go against the Chinese medicine principles a little bit here. Because according to the Chinese medicine clock, all the organs are cleaning themselves at different times. And in the morning, the sweet spot is between 7 and 9 is when we're meant to be refueling. That's when our yang is highest, and that's when we're meant to eat. But for me personally, I also think that that fasting, I love to do a 16 and 8 fast. That's my sweet spot. I feel if I eat in the morning, then I'm really quite lethargic. And because it's definitely different with women, but for men, we don't need to have breakfast in the morning. I think that's just a habit that we've fallen into. And like I said, because our yang is so high, we've got all this energy already because the sun's just come up, our energy is high. And then there's a whole process that comes with digestion as well. You don't just eat something and it turns into energy like that. There's a huge energetic taxation that goes on. Digestion is a really big process that I think we take for granted sometimes. So for that reason, yeah, I like the idea of fasting, but also done correctly and under obviously the guidance as well from someone else, so it can be monitored. Yeah.
I also find that the genetic piece comes in there sometimes. So some people do really well, and I agree with you. I think men have a bit more resilience to fasting.
Yeah.
I sometimes use the fasting mimicking diet, which was designed by Professor Walter Longo. He actually wrote a book called The Longevity Diet, and his research is all around calorie restriction because we know that there are benefits to DNA repair and this process of autophagy, that cellular repair and replenishment when we restrict calories. And his process is to do a step down calorie restriction down to about 1,000 calories for day 1 and 2, and then you just go to day 5 on 800 calories, which is pretty low. Most of us would be eating 2,000 or more typically a day, depending on who we are and what we eat. But that can be quite effective, particularly for men, I find, because it's a short and sweet fast. But then from after that, you then move on to something like 16:8 or 12:3, whatever works for people. But I also agree with Jane's point that for women, in our 40s and 50s, things start to shift and change, and we might not be quite as resilient to that extreme type of fasting. Yeah.
So also in Chinese medicine, our digestive organs, it's their job to hold and break down food, but they're never meant to be full. So that's the whole idea, to eat at that 80%. But they're also meant to be empty as well. They're meant to be empty so they can clean themselves and regenerate. So that whole progressive eating throughout the day and the snacking is really unhealthy, and it's really sluggish. It's also why people have so much. They can have that lapse in energy. I'm feeling tired, and you got to look at how much you're eating, because like I said before, that your digestion, it takes a lot of energy to do that. It's not a quick or a simple process.
Yeah, it's a metabolic process. So before we get I've got a couple of last kind of quick fire questions for our panel. What else are we interested in the room? What did you come here with a burning question around? Ooh, that's a huge topic in itself. The question was medication as opposed to natural remedies. Are you thinking specific medications or specific areas of health? Your PPI medication, gastritis medication, suppresses the production of gastric acid. Again, tell me if I'm wrong here, because So, that resolves the symptoms of gastritis. So gastritis is that feeling that some of us might have had in the room where we get a bit of stomach acid affecting the esophagus. So it feels like burning. We sometimes call it heartburn or indigestion. That process is sometimes because of a weakness in the valve between the esophagus and the stomach. And sometimes it's actually, naturopathically, we would see that it's actually being caused by a lack of stomach acid. Because what happens is if you've got too little stomach acid, the food that you eat gets into your stomach and sits there and sits there. And that too small or too dilute stomach acid means that food isn't getting processed within the appropriate length of time, and so it's not able to pass on to the small intestine, and that's when we get the regurgitation. So our thoughts on it are a little bit opposing to the normal medical model, in that we see it as, and not for everybody, sometimes it's not, sometimes it is actually a dysfunction of that valve. But for a lot of people, so firstly, I would say we need to investigate more. We need to maybe do an endoscopy, maybe have a look at actually what's happening in the microbiome is where I would go, to understand, is there a deficiency in the production of upper digestive enzymes, or is it too much? And then treat appropriately, rather than just going, you've got the feeling of indigestion, let's give you antacids. Because long term, many of those antacids do contain aluminium. So to Peter's point, aluminium is associated with Alzheimer's and dementia progression. We probably don't want to take that medication long term, maybe. or we want to solve why we're having that problem rather than just float the stomach with the antacids. So in answer, is it medication, is it natural therapy? Sometimes it's a bit of both. And that's why I work in a practice like this, because when I first started studying, I really wanted to see that medicine could come together, that it wasn't an alternative medicine or a traditional medicine, that there's a middle ground. Sometimes we need a bit of both. Sometimes we need one and then lean on the other in an acute sense. So, I'm anaphylactic, I carry an EpiPen. I wouldn't want, in an anaphylactic situation, to take some herbs and nutrients. I would definitely want my EpiPen. And for those of us around who've had to administer the EpiPen, it's not fun. So, there's room for everything. And I think that's where our practice particularly is great. We also do collaborative consults where, one of our natural therapists will sit with the GP and, we get to battle it out in real terms, without the punching, without the boxing gloves on. Thank you for the question. Any other questions? Yes?
Yeah, so statins are a little bit sort of much maligned, aren't they, really? A lot of kind of negative press about statins, but it's definitely been one of the most important medical interventions, that have come our way over the last 20, 30, 40 years in terms of longevity and reduction of disease, obviously particularly cardiovascular disease, heart disease, angina, stroke, peripheral vascular disease. So, they have been incredible medications, but, some people do get side effects with statins, there's no doubt. And I certainly think, that we've gone through phases where probably too many people have been prescribed statins just on the basis of their cholesterol levels alone. So I like to think now we take a little bit more of a nuanced and a targeted view towards how we prescribe statins. And again, that introduces the idea of, doing some more specific testing for the individual person. So, in the context of somebody who's not had a heart attack or a stroke and doesn't have a stent and has not had a coronary artery bypass graft, so in other words, primary prevention, we can do things like CT coronary calcium scores to look at, calcium deposition within the coronary arteries, which gives you a much more accurate predictor of risk for that individual person. So we might not be looking purely at the cholesterol level alone, but if we're a little bit worried about it, and maybe, the patient's also got a bit of high blood pressure, and maybe they've been a smoker at some point, maybe they have a family history, maybe they have diabetes, then we can use those extended testing modalities like CT coronary calcium scores, CT coronary angiograms, blood tests called a high sensitivity CRP, to target those treatments much more effectively. But, just to come back to the previous question, in the ideal world, every patient would be managed by a Western doctor and a team of natural medicine, providers together, because that's definitely how people are going to get the best results, not be on too much medication. We're taking a much more holistic view of that individual.
The way I see it is we can't all be experts on everything. I'd have had to spend another 8 years at medical school to have your qualifications as well. And, some people might want to do that, but I think working within our wheelhouse, but collaborating as much as we can is amazing. Thank you so much for those questions. I'm going to move to my quick fire round, if that's okay, so we can all get home before midnight. So I've got 3 questions for you guys. First one is, what is your biggest tip, your one longevity tip or supplement for 2026? I'm reading your minds. I know where you're going to go.
I've got like about 20, so...
Yeah, one. You can only go one.
I don't know. It's got to be about antioxidant fruit and vegetables, healthy
Stop.
fats,
One.
creatine, magnesium. Anyway.
So it's nutrition. It comes down to nutrition. Yeah. So it's a healthy diet.
Yeah.
Gotcha. Adam.
God, all right. I like a simple one. I like the inclusion of green tea. Green tea, it's high in antioxidants.
Yes.
It's got heaps of benefits for the blood, the brain,
Yes.
the skin, everything. Drink more of it. Matcha, yeah, but I find it's a little bit harder to prepare. And there's a beautiful ceremony with it. Just get yourself a regular green tea, and you can let it steep, make it strong. And if you forget it, you can come back to it. With a matcha, if you forget it, you've ruined it. So I just like a... Yeah, but when you're steeping like a Japanese green tea, I find that if you've only got a sweet window of about 3 minutes, and if you are a bit complacent, you miss that, it's over. So, but just a run-of-the-mill green tea is my suggestion.
That's a great suggestion.
Richard,
I'm on board with that.
Yeah, I don't know if it's specifically a longevity thing, but, I certainly made a few changes to my own regime on the advice of Julia and some of the other members of the team here at the beginning of the year, because I did test myself for all sorts of things. I did my smart DNA, I did my epigenetics, I did a DEXA scan, I did a live blood analysis. I basically put myself through the whole program as a guinea pig. And the things that came up was I need to be on a certain number of supplements, and I need to change my eating habits, and I need to go to bed earlier at night, and I need to get up earlier and walk the dog before work. And I tell you, those things have made... I know that's more than one.
It is more than one, but I'm gonna put that under the category of lifestyle change.
But maybe it's getting up at 6 o'clock in the morning and walking the dog has made the biggest change.
And I believe the dog's much happier now as well. Next question is, I'm going to start on this end, cold plunge or sauna?
Both. They both have their benefits. Okay. I love the sauna because it's also another way to detox the body. Like, how do we get things out of our body? And if it's not of our mouth or at the bottom, we get it out of our skin. The skin's super efficient. And there's benefits for both. I'm a big fan. I like to start my day with a sauna and an ice bath, and they're fantastic also for pain management. I suggest that my patients use them as well, like from carpal tunnel to plantar fascia. They get great results.
Great. Jane?
Sure, I'm sauna all the way, particularly for women. Infrared, I love that detox sort of inflammation reduction, the sweat, the process of sweating. But cold plunging, for men, they find, can be good unless you're going to have a heart attack. For women, it's not so good. It does put us in a really stressed environment. The temperature has to be 11 degrees or something. So I swim in my pool every month of the year. So it's not an ice bath, although it feels like an ice bath. Cool. I find it invigorating. So if you've been doing it forever and it works for you, keep going. But if you think all of a sudden at 55, I'm just going to jump in don't. Have an infrared sauna instead. And swim in the ocean. The ocean's never going to be an ice bath. So, swim in the ocean all year. And salt water heals everything. Tears, salt heals everything.
Richard, do you have a view on cold plunge or sauna?
I've never done an ice bath in my life, and I'm never going to do one now.
I'm not going to do one now.
So, I think whatever you find works for you as an individual that you're going to stick to a habit with, go for it.
Great. My last question of the night is, if you could give our lovely audience a $0 tip for longevity, what would your $0 tip be? So no devices, no supplements, it's not going to cost them anything. What are you going to give them?
Laugh and have fun with your friends and family.
Love that.
Enjoy your life.
Yeah, find the joy.
To enjoy.
Yeah, find the joy. Anything from you guys?
That's fair.
I think that's a pretty difficult one to top, isn't it? Really?
Love that.
Remember the good things.
And if you're not funny, find someone that is.
Yeah.
Okay, find someone that is.
Come see us.
I like the walking the dog. That doesn't cost an awful lot, does it?
That's good.
Yeah. I'll give my zero tip, and that would be to just look at your relationship with alcohol. I think, in terms of longevity, certainly when I was studying, the top of the pyramid used to be a glass of red wine, and even in the blue zones, and we can fight about this later if you like. They used to say a glass of red wine was good for the heart. It had all these ideal health benefits. We're now hearing very differently to that. And that's the wonderful thing about science. It evolves, right? So we're now seeing that alcohol isn't recommended. In fact, in 2023, the World Health Organization classified it as a class 1 carcinogen, which is the same as smoking cigarettes or inhaling diesel fumes. So, if you think of that, and the World Health Organization is kind of known as being a fairly conservative organization in their recommendations. So they're not going to make that recommendation without good reason. Also, in terms of cognitive health, we definitely see that the research now is showing that alcohol accelerates the aging of the brain. So, I think we can all just look at our relationship with alcohol and maybe make some changes if that feels like the right thing to do. And there's so much support around to do that now. There are non-alcoholic bars in Perth that you can go to, non-alcoholic wine. So, there's lots of ways that we can look at that. But it's been lovely to have you all here. Thank you so much for joining us. We will mill around, so if you've got specific questions for any of our panel, please do linger around. Like I said, my name's Julia. I'm happy to receive your connections if you want to on social media or through email address. You can pick up my card at the front desk there. Again, we've got Richard Newton. You can pick up his card if you're interested to chat to him specifically. Jane Mangini and Adam in the corner here. So thank you all again for coming. Do stick around. Oh, and we've got goodie bags as well. Thank you.
Julia.
Excellent,
Thanks, Gina.
thank you.